Reopening, unfortunately, doesn't mean going back to normal. It means bringing that same caution and that same commitment to stop the spread into our workplaces and our community spaces. It means continuing to meet the needs of families, seniors, and small businesses in what will continue to be a very difficult time. And it means continuing to follow the science and the public health guidance as we monitor data in the city as well as the state level. A few things I want people to remember about Boston. We have a population of roughly 700,000 people. We are the third most densely populated major city in the United States of America after New York and San Francisco. In normal times, our population roughly doubles in size every day as regional workforces enter our city and our workplaces. We are on the top list of tourist destinations. We're also a college town, and we have the greatest hospitals in the world right here in Boston. We are diverse, with residents that are 28% foreign-born, speak dozens of languages in their home. And we are the hub of social services for the most vulnerable people across the region. So we have unique concerns and situations about how we prepare and what we prepare for. And we especially focus on equity and meeting the needs of vulnerable communities, families with children, seniors, and small businesses. I want to thank the governor's administration and the members of the advisory board for their work on their plan. We had input into the plan. We made sure that Boston's economy was understood and our communities were represented. Among other things, we submitted a letter from our COVID-19 Health Inequities Task Force articulating the needs for recovery that address the negative impacts felt in communities of color and low-income communities in our city and, quite honestly, across the Commonwealth. We remain committed to a healthy reopening and an equitable recovery. I want to be clear about Boston, and Boston is moving forward on other major industries and issues in our city. As of yesterday, the state's plan allows construction to restart. In Boston, we have a phased-in approach, in comprehensive health and safety requirements. Work on schools, hospitals, and smaller residential projects and open-air construction is restarting this week, while other work allowed by the state may resume next week, Tuesday, the 26th. The reason why not for Monday, the 25th, because it's Memorial Day. In every case, we're requiring contractors to submit a COVID-19 safety plan before returning to work. To help sites meet the requirement, we have hosted virtual safety planning meetings, as well as safety training for inspectors. We have produced a video guide along with other reference materials. Already we've trained and had nearly 2,300 safety plans submitted to ISD. We've trained all of our inspectional services staff and supplied them with personal protective equipment. This plan is a good example of how we are approaching the challenge of a safe reopening. We acted early with a construction phase to keep workers safe. We rescheduled the special public health challenges in the industry. We engaged the employers with the workforce around their needs and challenges. And we developed a phased-in plan with guidance and resources for a safe return, and continually having communication. For office space, we are also developing a system of guidance and support. We have a uniquely large, dense, dynamic commercial sector here in the city of Boston, in a wide variety of buildings and workspaces. So the statewide plan allows for 25% capacity starting on May 25th. But in Boston, we will take this first step on June 1st. This allows us to work collaboratively with building owners and employers on safety plans that meet robust public health standards. Every employer has a responsibility to create and implement plans for your workplace that minimize the risk of COVID transmission. But we want to help you. So we are drawing on a range of national best practices and expert input to create guidelines that you can follow. They cover everything from shift scheduling to work-at-home policies, to physical spacing, PPE, cleaning protocols, ventilation, employee communication, and so much more. Our guidelines will be shared next week and will be available to provide support on how to create a plan and help keep your workers safe in your workplace up and running.